Good morning, everybody. It's a pleasure to be here. I'm Nick Freudenberg. I teach public health here at the City University of New York School of Public Health, and I'm the director of our Urban Food Policy Institute. And it's a pleasure to be here with you again today. I have some good news today about today's session. It's not, directly at least, about COVID-19. We imagine that all of you are getting zoomed out on sessions about the pandemic and wanted to raise some different questions today. But of course, it's not possible to gather more than one person these days without COVID coming up. So I can't make any promises that we'll be able to avoid talking about our current situation. Grace Paley, one of my favorite writers, once said that hindsight, usually looked down upon, is probably as valuable as foresight, since it does include a few facts. In these days, when facts are often disparaged as being inconvenient obstacles to some ideological goal, there is a value in looking to the past for lessons to guide our action in the present and future. And I think that hindsight is a luxury, of course, but it can keep us grounded in evidence. The ideas behind today's session is that in the recent and not so recent past, cities and nations have confronted human and natural disasters that disrupted our food system, made it more difficult for people to get the food they needed, to avoid hunger and food insecurity, and to restore our food economy. We can go back to the Great Depression and World War II, when hardship contributed to the sprouting of victory gardens throughout New York City, to the fiscal and economic crises of 1975, the early 1990s, and of course 2008, which led to significant increases in food insecurity and new efforts to meet the needs of vulnerable populations. Natural disasters like Hurricane Katrina in Louisiana, Tropical Storm Sandy here in New York and elsewhere are other examples of crises that required us to rethink how we get food to people. In most cities, emergency responses and disaster planning are quite separate from long-term planning, and that's true for food as well. So our questions for today are, how can we better connect emergency response and long-term planning as they relate to food? How can we use our short-term responses to crises like hurricanes or epidemics or economic collapses to address both immediate needs and the deeper problems that precede and follow these crises? And I told you we couldn't avoid COVID. How can we apply these lessons to the overwhelming health, economic, and social costs that COVID-19 is imposing on us now? Before introducing our speakers, I wanted to share a short lesson I've been thinking about a lot these days. My public health career began in confronting the HIV/AIDS epidemic in New York City. I worked in HIV prevention and services in neighborhoods like the South Bronx and East Harlem and at Rikers Island. In response to the difficulties our healthcare and social service agencies had in meeting the needs created by HIV, activists and policymakers created the Ryan White program, a federal program that provided hundreds of millions of dollars to create and expand HIV services to meet these needs. It was an incredibly important program. It set the precedent for using disaster funding to meet human disasters as well as natural disasters. And it enabled many agencies in New York and elsewhere to fund the new services that were needed and to meet the needs of the many populations encountering high levels of discrimination, homophobia, racism, and sexism. But with the benefit of 4 decades of hindsight, I wonder if we missed an opportunity in our advocacy and structuring of the Ryan White program in creating a separate parallel healthcare and social service system for people with HIV. Yes, I know and understand why we had to do this, but the decisions we made in this crisis led to the creation of an HIV care system that was separate from the system as a whole. It was vulnerable to political pressures and cutbacks. It was precarious, and it was challenging to sustain as the epidemic changed. Could we have fought harder to integrate HIV prevention and care into our neighborhood health centers, hospitals, and social service agencies? If we had allied with proponents of a single-payer health plan, could we have made additional progress in establishing the right to health care for all? If we had successfully integrated HIV care into all health care, could we have set a model for integrating mental health services, still now segregated in our healthcare system? Our hope for today's session is we can begin to ask these questions about how to balance our understandable desire to meet the immediate needs imposed by COVID-19 with a long-term goal of creating a more equitable, resilient, sustainable food system. One last point in relation to my HIV story. Yesterday, Larry Kramer died. He was a founder of Gay Men's Health Crisis, of ACT UP, and a leading AIDS activist. As we plan our long and short-term responses to COVID-19, let's remember Larry, the organizations he founded, and the many other wonderful HIV activist groups like Housing Works, Latino Commission on AIDS, ADAPT, the Association for Drug Abuse Prevention and Treatment, Vocal, God's Love We Deliver, and many more. The activists who created and led these groups ensured that public agencies and public officials addressed the human and moral dimensions of that epidemic and used it to address the underlying structures that facilitated the rapid spread of HIV. Let's hope that COVID-19 is incubating similar organizations and leaders, and that we can again depend on their activism to get our response to this epidemic right. And with that, I introduce our first of three wonderful speakers. Kim Kessler is the Assistant Commissioner for the Bureau of Chronic Disease Prevention and Tobacco Control in the New York City Department of Health and Mental Hygiene. And she was also the Food Policy Coordinator for New York several years ago, and the person responsible for addressing the food-related dimensions of Tropical Storm Sandy. Welcome, Kim, and we're happy to have you here today.
Thank you so much for that introduction, Nick, and really a really thought-provoking introduction to the conversation. I'd love to start by sharing a little bit more background about my role at the Health Department. Our Bureau, Bureau of Chronic Disease Prevention, is dedicated to reducing the burden of chronic disease, and that includes heart disease, cancer, diabetes, among all New Yorkers. And what we strive to do is use evidence-based approaches to shift environments and systems with the goal of preventing chronic disease and also promoting more equitable health outcomes. And we do this with the aim to really address the inequities that have resulted from decades of disinvestment and structural racism, and that have shaped the social conditions in communities in ways that exacerbate the risk of both chronic disease and the issue that we're here to talk about today, emergencies. And I really appreciate the opportunity to join with you in reflecting on this. As Nick mentioned, I had previously been in the role of Food Policy Coordinator during the last 3 years of the Bloomberg administration. I then left city government at the end of 2013 and returned to my current role at the Health Department in 2016. I want to acknowledge that there are many, many people in city government that propel the city's emergency planning, resiliency, and food support initiatives. That was true during Sandy, during all the time between now and Sandy. And I'm really joining today to offer one perspective from the vantage point of my current position at the Health Department. I plan to talk about Sandy and then turn to the current crisis. And I especially want to reflect with all of you on how it is that we make meaning from and understand emergencies and their aftermath. Next slide. So many of you will immediately recognize this picture as a food distribution site in the times before COVID-19. This is a site in Far Rockaway, Queens, following Hurricane Sandy. And just looking at this picture is an immediate reminder of how very different our current circumstances are, because past emergency food distribution has, of course, been done from congregate sites. And this was a major part of the first wave of Sandy response, with millions of meals being distributed throughout New York City and the impacted areas through multiple channels. Over the longer term, the city also worked with USDA and New York State to increase New Yorkers' access to food support programs, from increased distribution of school lunches for the months following the storm, and also increased SNAP benefits. Support for the Emergency Food Network was also part of the response, including through Mayor's Fund grants to City Harvest and the Food Bank, which in turn distributed mini grant funding to soup kitchens and food pantries that were contending with the needs of new clients following the storm. Next slide. Following Sandy, the city went through a formal after-action process and incorporated lessons learned into its food access plan for emergencies. For example, the city put on-call emergency contracts in place for food and trucking support, both of which have been leveraged for the current emergency. Without a contract in place, the city had previously been much more reliant on meals ready to eat, or MREs, that were available through federal partners. After Sandy, the city's commodity distribution point plan was also strengthened. Additional staff were trained, sites were identified, and site setup kits were created. While this distribution plan had to be adapted for the current emergency to account for social distancing, these changes gave our emergency response leaders a solid foundation to work from. And this commodity distribution point plan is just one piece of the broader emergency food access plan, which also reflects the lessons of Sandy, and through which the city considers how to strengthen existing infrastructure, such as food pantries and the private food sector, while providing emergency feeding. Next slide. In addition to the ways that our emergency food response planning was informed by Sandy, the unprecedented physical impact that the storm had on the city, the flooding, the loss of power, the enormous damage to buildings, homes, and infrastructure, deeply shaped our collective understanding of Sandy and its implications. The image on the left, many of you will recognize as the Hunts Point food market. Hunts Point was identified as an important vulnerability because if Sandy had taken a slightly different path or arrived during high tide, there could have been major interruptions and loss of inventory as a result of storm surge. And even without major flooding at Hunts Point, Sandy left entire neighborhoods with limited or no retail food access due to flooding damage and electrical failure. And it demonstrated the scale of risk that storm surge posed to all of New York City's major coastal communities. So after Sandy, Mayor Bloomberg appointed the city's first director of resiliency and issued a major resiliency plan, shown on the right, which among its over 250 recommendations called for a study on the city's food distribution system. That study was completed in 2016, and investments were and continue to be made in the city's infrastructure, including to the Hunts Point market. I think most of us would agree that the major legacy of Sandy, to an extent that may be hard to appreciate now, is how even in a city and a mayoral administration where combating climate change had already been an important priority, the storm and its aftermath pushed climate change mitigation and adaptation to the forefront of the public dialogue. So to turn to the current crisis, it raises the question, what will the legacy of COVID-19 be? Next slide. I'm going to start with a brief snapshot overview of the city's current response effort. In March, Mayor de Blasio appointed Sanitation Commissioner Catherine Garcia, pictured here as the city's food czar, to create and operationalize a cross-agency effort to feed New Yorkers who lacked access to sufficient food and to ensure that our food supply chain is secure. This appointment in and of itself speaks to the city's recognition of and commitment to address food needs throughout this crisis. Hundreds of city agency staff are supporting this effort. Next slide. And in understanding the enormity of the challenge facing the city, we need to understand the current context of food need in New York. Even before COVID-19, there were an estimated 1.4 million New Yorkers that reported relying on food pantries and soup kitchens, and 1.2 million that were food insecure. So broadly speaking, the response is seeking to address the needs for the groups most at risk, who include youth whose access to food is impacted by school closures, New Yorkers over the age of 60 and others especially vulnerable to COVID-19, non-citizens who may not be able to participate in federal benefits or services, communities of color who are disproportionately affected by food insecurity and underlying health conditions due to structural racism, yet who represent a majority of the food service workforce, and hundreds of thousands of newly food insecure people impacted by the economic downturn, including many who have never accessed government benefits or food support in the past. Next slide. Feeding New York is the city's published plan about the efforts to feed those who lack access to sufficient food during the crisis and to protect the security of our food supply chain. I want to note that the plan talks about the importance of equity in the response and is written with the awareness of the existing structural imbalances in our food system. Two aims of the city's food response plan are to ensure that the New Yorkers have access to food that they need, and then second, to secure the food supply. And the report outlines that the response will be phased. First, we have the immediate response, taking steps to secure our food supply chain and feed hungry and vulnerable New Yorkers. And over the longer term, the city's aim is to prepare for evolving and growing needs and build resilience into our food supply system. In total, the city is investing $170 million over the next several months into this unprecedented effort. Next slide. I'm going to highlight the food access part of the response, which has been named Get Food New York City and provides multiple channels for New Yorkers to access food. There are New York City's grab and go sites where any New Yorker, adult or child, can go and get free meals. There's the New York City's Emergency Food Network, or pantries, some of which are closed, but the city hosts a map of current pantry locations and is working to support the emergency food organizations that do remain open. On April 10th, New York City announced a $25 million program in funding to support emergency food providers that have experienced great increases in demand as well as increased costs. And then there's also the Emergency Home Food Delivery Program, which I will describe on the next slide. Any New Yorker can call 311 or visit this webpage shown on the slide at newyorkcity.gov/getfood to find out how to access these resources. These food access and delivery programs are also complemented by policy advocacy for resources for New York City. And this response has many similar elements to the food response after Sandy. And it is also entirely different in terms of the challenges posed by social distancing requirements, which mean that prior plans for emergency food response and congregate feeding had to be reinvented. The other major difference from Sandy is the scale of the effort and the vast scope of the need, which is distributed across the city. As of last week, the city announced it had served over 32 million meals, and that number is growing each day. Next slide. To talk in a little bit more detail about the Emergency Home Food Delivery Program, which is the program for those who have no other option or means to get food at home. This was developed specifically in response to the needs of this particular public health crisis and the requirements of social distancing. So the program provides the opportunity for those who are at risk for COVID-19, including seniors who don't have anyone to get food for them, who can't afford grocery or meal delivery, and who aren't getting enough meal from any other program. It provides 3 days worth of food per delivery. This can be meals or pantry bags, and you can sign up for recurring deliveries for up to a month. And anyone can access this by signing up through our website or calling 311, or through what's called an authorized enroller program, through which CBOs, including senior centers, are able to enroll New Yorkers. As we think about the longer term, we know that this intense period of work and collaboration will lay the foundation for new partnerships and improvements. But it, of course, invites us, just as Sandy did, to rethink our approaches to food support and food supply. Next slide. To me, this is the key question in thinking about the longer term impact of this event. How will we as a city come to understand COVID-19 and its relationship to food equity? How we come to interpret and explain COVID-19, its impact on health and food security, is what will drive our long-term response. None of us can know the answer to this question today, but all of us and all New Yorkers will play a crucial role in developing this shared analysis. Next slide. Here's something that we already know about COVID-19. While it affects all of us, it also underscores and brings new visibility to the underlying systemic injustices in our city. This map on the left shows the rate of confirmed COVID-19 cases per 100,000 residents by zip code. And these are headlines about higher death rates from COVID-19 among our communities of color and our poorest neighborhoods. The inequitable outcomes we see in COVID-19 should not surprise us, and nor should the vast need for food support during this public health and economic crisis. They are a reflection of the underlying and deeply concerning reality in New York City. Next slide. These maps make clear how we all live within systems and structures that shape our opportunities for health. They show by neighborhood the percent of poverty, the population of Black New Yorkers or Latinx New Yorkers, and premature mortality rates in New York City, respectively. If you note the darker regions of each map above, you can notice that poverty and premature mortality track closely with racially disparate New York City neighborhoods. The inequities that we've known about for a long time are exacerbated due to COVID-19. And we know that people need good jobs, clean parks, good food, healthcare, and healthy homes that are affordable to have good health. But these resources are not distributed equitably in New York, and racist policies and practices have shaped this reality. These are the injustices that result in the inequitable outcomes across innumerable issues, including food security. And as all crises do, COVID-19 makes even more clear the underlying fissures, the issues that we have failed to address as a society. And so as I think about how to integrate our lessons from this pandemic response into our food planning and what is needed to build a deep resiliency, from food support programs to affordable housing to equitable access to healthcare and education, I hope that we can focus on these undergirding inequities and what is really needed to tackle them. I think the key question is, will equity be pushed to the forefront of our collective understanding of this event, as the need for climate change adaptation was for Sandy? Fundamental to any major changes that follow from addressing this crisis will be having a shared analysis of what brought us to this point. And my hope is that that shared analysis will seed solutions that truly address health equity in New York City, so that all New Yorkers have access to the resources and opportunities they need and want to be healthy, including good food. Thank you.
Thank you so much, Kim. A really thoughtful integration of the immediate lessons, both from Sandy and some of the current work around COVID, and the deeper underlying structural factors that you ended with. And my question for you is, using the luxury of hindsight that Grace Paley talked about, as well as the facts that you summarized for us, do you think there are lessons from Sandy about emergency food planning that New York City did not adequately learn and implement? And how do you think that if you can identify such things, how do you think the current New York City responses to the food consequences of COVID can avoid repeating omissions like that?
I think one of the hardest and most persistent challenges that was certainly present during Sandy, and I think remains a challenge, is coordination. There's so much that happens in New York City every day, but certainly during an emergency, and so many important contributors to responding to events like these. And I think during Sandy, it was a challenge to try to figure out how to best coordinate those resources so that we were really meeting the needs. And in this event, where the need is much more distributed and even greater, I think this remains one of our challenges. And there's a lot of effort that goes into that. I think stronger communication channels were established from the get-go during COVID-19. One of the things that you see in an emergency is some really nimble responders who emerge to meet the needs that they see on a neighborhood basis, and figuring out how the city, who struggle sometimes to act nimbly, can support those kinds of initiatives early on is one of the things I think we can continue to develop and strengthen in government.
Thanks. Again, reflecting on my HIV experience, I think it took a very long time into the HIV epidemic for city government, healthcare and human services groups, academic and researchers, and advocates to really come together and develop a shared agenda. And I'm pleased to see how the city is reaching out to social service agencies. I think we in academia could do a better job of connecting to those discussions and supporting those efforts to really understand the impact of what's going on. And we look forward to working with you and others to make that happen. Our next speaker is Holly Freistadt, who is Baltimore City's first and current food policy director. She began in 2010. She created the Baltimore Food Policy Initiative and has led the work in addressing resilience and climate change in Baltimore. And we're very pleased to have her here to share lessons from that experience with us today. Holly?
Great, thank you very much. Hello, everyone. We're just waiting 1 second for the PowerPoint to load, and I'll be happy to speak. 1 sec. Okay, can everyone see my screen. I assume that is a yes. All right, I'm Holly Freistadt, Food Policy Director for Baltimore City. Thank you for the introduction. I'm going to speak to how emergency food resiliency planning has impacted how we planned and implemented COVID-19 food response. So to start, in collaboration with Johns Hopkins School of Public Health, we produced a Baltimore Food System Resiliency Advisory Report. And this was really instigated after the uprising in 2015, and then we had a big storm of Jonas in 2016, and therefore it resulted in this report. Some key findings from the work that we've done in the past with food resiliency planning are a few. One is we have a food system staffing structure in the Department of Planning through the Baltimore Food Policy Initiative. We have myself, we have a food resilience planner, a food access planner, and most recently a food systems planner. So our staff does food and food only and how it intersects with everything else in the city, which was very important as we move forward to when I discussed COVID-19. But one of the key things that was learned from this report was to reallocate one of my staff people to the title of food resiliency planner. So that was very important. A second piece was that now our food resiliency planner reports to the Emergency Operations Center in times of emergencies. And also we were able to create a plan that is in our Emergency Operations Center specifically related to food. So I am going to speak about COVID-19 quite a bit and share how the work we've done in the past has been helping us move forward, and also the challenges that we face in COVID-19 from a food resiliency perspective. So one of the key things that our plans from the past was based off of congregate feeding masses of people in one place, which is not appropriate for the pandemic. The second piece, planning process. We did a really good job starting off in the first 6 weeks of doing our daily calls with the emergency food response team. It helped create our strategy. The challenge is the response is long, and daily calls or bi-weekly calls, it's just too much. We're all getting call burnout and Zoom burnout. So it was very good in the beginning, but it's still harder to keep track with everyone moving forward because of the magnitude of calls that we were all facing. Another component is that we are a part of the Web EOC and are being able to influence sort of the decision-making that's happening as it pertains to food. Okay, this is a wheel that we created for the reports with Johns Hopkins and for our emergency food resiliency. We just adapted this to the COVID-19. So you can see here there's around 14 city agencies at minimum. There's many community organizations. There's our emergency food nonprofits. Maryland National Guard has played a significant role to date, and the state and federal agencies as well. So you can see the COVID-19 food response has to be collaborative, interagency, intergovernmental, and everybody under the sun working together. So our team in the Department of Planning, we are looking at short-term and long-term plans and strategies and policy. So therefore, we've been looking at best practices. One of the assets we have found has been with the United States Conference of Mayors Food Policy Advisors. We have been meeting weekly through the COVID-19 food response, and therefore you will see that many things I'll be lifting up today have been used and borrowed from New York City. Thank you, Kim, and your city. DC, many other cities. We are all using each other's work because we all need to do the most comprehensive, quickest approach with a resiliency lens as possible. And so another component is looking at food security, the work we were doing prior to COVID. How do we continue to bring it forward in our response? We already have our resident food equity advisors who get paid for their time to help us with strategy and implementation. We have our Food Policy Action Coalition and many others. So we really wanting to continue to do the work we've done in the past while working on the food response. So here is the map. We have been doing extensive food environment mapping with the city for the last 10 years. We had a healthy food priority area and all our analysis, and none of it is relevant because data is changing too fast, because unemployment rates is skyrocketing, food insecurity and SNAP is skyrocketing, and therefore we made a decision not to use our healthy food priority area definitions and maps, but rather use SNAP data. So because we're in a time of disaster, we're able to get the SNAP data on a monthly basis that we can then map and track over time. And so that is how we're starting to identify where we need to put our resources and our sites, understanding that we have a back-end layer that's looking at COVID-19 and also immigrants who may not be benefiting from SNAP and placing distribution sites in those areas. I will talk more to that, but summary is we have over 200 sites in the city, older adults, school sites, rec centers, community sites, and public housing. And to date, we've done approximately 2.5 million meals. We have here as a resource for later, a public-facing map that we built for COVID-19 as well, so people can see where to go get food resources in the city. We are doing a tremendous amount of tracking and data management to be able to show change over time, and also where our strengths are and where we need to be able to improve. So our strategy, this is the strategy through June. You can see that the goal, minimize hunger in Baltimore during a pandemic. Well, that is a hunger response goal. The next phase of our COVID-19 response, which is starting now in June, is to transition that goal to more of an equitable, resiliency-oriented frame of how to address food resiliency and hunger and food insecurity through a different lens and just sort of a hunger approach of feeding the most amount of people possible. But this was really our starting point for the first 2 to 3 months. The key components of our strategy is meal distribution, food retail, and urban ag. I will speak to that in a moment. So with the grocery box distribution, we've partnered with the food bank. I know many other cities around the country have done the exact same. It's a shelf-stable food. The one thing that we were able to benefit is that we were able to work with the food bank very early on before they had significant supply chain issues. And we're able to secure the boxes on an ongoing basis. So we have 30,000 boxes going to 42 sites on a weekly basis. Sorry, 30,000 boxes monthly, but we're going to 42 sites weekly. And so that comes to around 7,500 boxes are circulating on a weekly basis in the city. And then we're working with the Maryland National Guard to do the delivery, which has been a great asset. I will get to my last slide later and talk about the challenges of that as well. But up until now, it's been a really strong asset to be able to get our food delivered. One of the components that New York and DC and Austin and many others have been doing is getting home delivered grocery boxes. We are doing the same. We have a partnership with Amazon. They're doing it pro bono, where they are doing our deliveries. All their boxes are getting stored in our convention center. There's a screening and referral process so that people will call 211, and then our senior adult line called MAP. And then we're also working with NGOs in the Latinx community who can do their own screening to be able to get home delivered boxes. And so that has been increasing over time. And that's been a part of our home delivered strategy. Produce, this has been a really new component and a very exciting piece. This is thank you to the USDA Farmers to Families food boxes in partnership with the Coastal Sunbelt and Common Market. We have 14,000 produce boxes weekly at 48 sites. And several of those organizations are doing home delivered boxes. This is also a great asset. I'm happy to say that we have more produce flowing into the city than shelf-stable product. It has a higher nutritional value. And that one of the things that we worked really hard through the planning perspective is lifting up and supporting community organizations. This has been one of the challenges and one of the components that we've been trying to address is how do we help the nonprofits get the food they need to serve the people that they always were serving and want to continue to serve as the numbers increase. And so one of the ways we've done that is to have Coastal deliver produce boxes to many of those organizations who were having supply chain issues getting the food that they needed. We also, like many cities, are doing meal distribution. With the older adults, the health department is point on the strategy for older adults to get meals to them. With Meals on Wheels Salvation Army, we are also doing the summer meals, the grab and go sites. And then we also have been partnering with World Central Kitchen. The third part of our strategy is around urban agriculture, really local food system resiliency. We're seeing a lot of funding and money flowing into the city. We really want to see that money have a long-lasting result. Therefore, we are really supporting our Farmer Alliance of Baltimore, Urban Farms, Black Church Food Security Network to really see how can we invest in agriculture in Baltimore City so there's land tenure and that these growers can continue to grow now and to continue to grow into the future. And also one of the challenges we see is that nonprofits are also at risk during COVID-19. We have heard a lot about businesses closing down, stores, restaurants closing down. Another component is our nonprofits are also struggling, and they could be having consequences of COVID-19. Our Maryland Farmers Market Association went down and under through COVID-19. We want to make sure that our Farm Alliance of Baltimore and other nonprofits who are doing feeding and agriculture can have the support they need now and into the future. We've also been working with our farmers markets to make sure that they stay open with social distancing measures, and really trying to help philanthropy allocate their resources towards food resiliency and agriculture and lasting impacts into the city. I'm not going to speak too much about SNAP, but one of our strategies is to maximize and leverage as much federal resources as possible into Baltimore City to provide food. And so one of those pieces is making sure we get as many people on SNAP as possible. We were able to get online SNAP in place. It launched today. So online SNAP is happening starting today, which is very exciting, to allow residents to order at home who are on SNAP and be able to get it delivered. And then also with pandemic EBT, making sure that people are opting into that program. Okay, this is actually my favorite slide, which is really reflections. There is so much to be learned. I would say that in Baltimore City, we have done a phenomenal job responding to COVID-19, yet it is not enough. It is not even close to enough. There's so much more that needs to be done. COVID-19 is making us move in a very fast-paced environment, that everything is changing very fast and everything is very urgent. So even though we have been coordinating and collaborating and mobilizing resources, the challenges are still significant and we have a long way to go. So here are the challenges. Data. We've done phenomenally with getting data of our healthy food priority areas, but data is out of date before you can blink. When it comes to income, when it comes to food insecurity, the numbers keep changing and growing, and getting relevant data related to that is very difficult. We're doing that with SNAP. We're getting the COVID-19 data because the health department and the state's doing quite a bit of analysis on that, and we see that data, but how to overlay that with the food insecurity has been a challenge. Transportation, we've built an entire system on a deck of cards. So our National Guard has been phenomenal. They have been transporting all our food. The National Guard will be closing their service with the city of Baltimore in the next 2 weeks. So now we need to figure out a new transportation system to move the food that we have in place. Also, we have it with Amazon, which is phenomenal, but that's a month-to-month relationship. So we're building, once again, a system reliant on others to provide transportation. And the reason we've done that is just due to the cost. The costs related to transportation, we're really trying to minimize the costs where we can and partner with those who can support us. And that's why we've chose that way. But now we'll have to start to look at other methods. Communication has been a struggle. When we go into big pandemics like this, we have our strategy for the city. It's called the JIC, which is a Joint Information Center. And so everything has to go through one location. So anything that goes into the JIC, we need to usually wait many days to be able to get it back out, to be able to do social media, to be able to communicate quickly and widely, which is a struggle when there's so much that needs to go through the JIC. Staffing, we learned from New York. We loved the model, Kim, if you're still on the line, of the org chart, but there was a lesson to be learned for Baltimore. It did not apply out the same way as we thought when we looked at New York, is that we did have an org chart structure where I have an entire team on food and all we do is food. But what we did is that we decided to have some other leaders working on that, which started off really strong, but everyone needs to go back to their jobs because the city is opening. And as the city is opening, people who are doing the food response are not able to do it as much because they have many other responsibilities. So there is a big question around staffing. The other question, I think, longer term on resiliency is the decisions that cities make on who can do remote work, telework, and who cannot. Our city, from the very beginning, when COVID-19, when we started to look at social distancing with COVID-19, we had a lot of people who were not able to do telework, and so they went on permission leave. As a result, we did not have as much staff. That also applied to the state to be able to do their SNAP application process. So I think that there is future work to be done on how we decide who goes on permission leave and who does not during pandemics. We've all heard of the significant supply chains with our grocery stores and also with our food banks and with our nonprofit food pantries. Procurement contracts, I thought we did a really good job with the procurement contract for summer feeding programs. We got that in place in times of emergency, but where we need to move to is getting procurement contracts for nonprofits so that they have continued funding during times of emergencies. Our next steps is really looking at our evaluation and assessment of COVID-19 food response as we continue to respond, and looking at a long-term plan. That concludes my presentation. Thank you very much.
Thanks so much, Holly. And I'm really struck by both some of the similarities and differences with your experiences and what we heard about New York. Before posing a question to you, I wanted to remind participants that we'll be inviting you to submit questions on the chat line, and you can start doing that anytime. You can direct them to the panel or to a particular person. Holly, Baltimore was in the forefront of cities that looked at food system resilience in response to threats. Using that luxury of hindsight and Baltimore's experience with COVID to date, are there things now that you wish Baltimore had done to protect food resiliency in 2017 or 18 or 19 that could have further strengthened the resilience of its food system? And how do you think cities can avoid the tendency to study and plan for the last disaster instead of the next one?
So I'm going to answer your question backwards, because your last question is the brilliant question in my mind of, we all want to learn from the past, so we respond to the most current issue that we're facing. So for Baltimore, I would say I'm glad we did respond to the uprising and this Jonas in the way that we actually have staff and a food resilience planner, that we actually have a plan. Because what we found in Baltimore City prior to our food resiliency work was that there was no plan for anything less than mass shelter and care. So we had plans for when anyone was sheltering in place, but there was no food plans for anything in between. So I'm glad that we were able to build that system and plan that we did build from for COVID-19. I think we just never predicted a pandemic with such social distancing measures. And that is one thing that we have learned from. And I think that the reality of plans and working in the Department of Planning is that they continue to need to be updated, and we need to continue to put resources. A plan is never done. It just needs to be implemented, learned from, and then revised. And so I think that we're building from that resiliency plan from 2017 and really looking at how do we embed that into the Emergency Operations Center. I think that was, now I can't remember the first part of the question.
Is there something you wish you had done earlier that would have left you better prepared?
So I wish, yes, there's so many things. One of the things is contracts. Even though we have an emergency contract process in the city in times of emergency, it is still very cumbersome, it's difficult, and it's still slow, but it's faster than it normally is. So I would want to have contracts in place and identify the community-based organizations where we could be able to have contracts with them to do the work of the city on feeding, because that is one piece. We had it for the summer feeding program, but we did not have it for nonprofits. So that is one thing. Another thing is we must have, when we talk about resiliency and emergency planning, is plans and then backup plans and then backup plans for those plans. Transportation. That is a great limitation that we have seen during COVID and a struggle for us. And I would say that I wish we could have planned more for the transportation of food and having plans for that in times of emergencies. The other component we just never could have imagined is the length of the response. The length of response, we built this off of snowstorms, and we built it off of 2 or 3 weeks from the uprising of response. We never imagined would be in month 3. And so length of response. I think those are some of the key lessons that I've learned, and also really looking at I think that our partnership with the Mayor's Office of Emergency Management is strong. But I think that as we continue is to have more specific plan. We're falling into mass shelter and care in the ESF 7. Whereas now looking at it, I think we should have a section just on food. and it shouldn't be embedded into a section that has 200 other things as well.
Great. Thank you so much. Our third and final speaker is Barbara Emanuel. We're happy to have a North American neighbor to join us to give us a different national perspective. Barbara recently retired from the city of Toronto, where she was the manager of the Toronto Food Strategy, an effort to develop a plan for a sustainable food system. We welcome you, Barbara, and I turn it over to you.
Hi, thanks, Nick. And it's great to be here. I have one foot still in the city, having spent nearly 30 or over 30 years working for the city of Toronto and in transition to retirement. I was completely unable not to talk about COVID, but I am focusing on the shift from crisis response to long-term food systems planning, but informed by some of the work that we did in the city around our food vulnerability assessment and other things. So here goes my thoughts. COVID-19 has shone the spotlight on inequities in all systems: health, housing, social services, economics, food. Much has been written and discussed about how this pandemic is unprecedented. No one knows what our institutions, economic structures, and social systems will look like post-COVID. While there will continue to be immense suffering the world over, I really believe we have some real opportunities to make crucial systemic changes and to prioritize health and equity in all systems. In Canada, and likely the world over, this is a time when the whole country is aware of our food system. At a broad level, people are becoming more aware of where our food comes from, mainly as a result of disruptions to our food supply, and with the increasing numbers of people finding themselves food insecure. The spotlight is really on the vulnerabilities in our highly concentrated, specialized, and globalized food system. Of course, having enough good food to eat is a daily challenge and reality for many people, and these stresses have only been amplified during the pandemic. So comprehensive emergency preparedness includes emergency planning, emergency response, and recovery. And I strongly believe that it's essential to embed more long-term systems thinking and enabling policy into immediate emergency response. Of course, this is immensely difficult when the immediate pressures and demands of the emergency are so enormous. And yet, we have this unprecedented opportunity to reorient and rebalance our policies and priorities to ones that support city-region food systems and ones that leverage collaborative partnerships and local action. So what have we learned? All cities have been on the front line of emergency food provision during the COVID crisis. That shines a light on both the tensions and the opportunities emerging from the outpouring of support and resources, and the demonstration by government that it is in fact able to pivot and make quick decisions. But I believe the charitable response, while it's absolutely essential to meet immediate needs, can take away confidence and pride, and may or may not promote food security and community resilience in the longer term. In essence, I believe we have to shift to a solidarity response, one that claims we're all in this together. Policy and systems thinking tend to get suspended during crisis response. Therefore, how do we embed systems thinking and promotion of resilience into our emergency response. This would mean that if one part of the system breaks down, the whole system doesn't collapse, and communities and cities, for that matter, would have the means to withstand current and future shocks and be better able to address the chronic stresses and move much more quickly into recovery. There are no quick answers to this, but I believe it's essential to grapple with it right now. Our supply chains need to be retooled and regionalized whenever possible to handle such disruptions and to promote resilience. Our food system must become more diversified and therefore more nimble and able to pivot to meet both shocks and stresses. And more than ever, we're seeing that our large concentrated systems are not resilient. So being recently retired, I'm no longer on the front line of the response, but I have witnessed wonderful new collaborative partnerships and a massive outpouring of generosity and mutual support from the public, from institutions, the private sector, community agencies, and government. The other speakers also spoke to that. And this collaboration has, in many instances, crossed traditional silos. And actually, what we've always talked about in terms of public-private and not-for-profit collaboration is actually happening right now. But the question is, will it remain? One excellent example from Toronto's response is the conversion of a number of libraries into food distribution centers. The infrastructure in terms of warehouse capacity and distribution logistics, staffing, and space have made it practical and feasible to pivot to a food hub in collaboration with food banks and food rescue organizations. And libraries are places where are based in neighborhood settings, and people are already comfortable using their libraries and going there. So, however, it is unclear whether this collaboration will be allowed to continue as the city moves towards recovery. The good news here is that community leaders and city staff, or some city staff, are stepping up to the plate to ensure such service continuity, at least in some of the libraries located in the lowest income neighborhoods. But I believe we have the chance to reimagine now what libraries can become in the context of food security and community resilience. We have to push to make that happen. Another wonderful example is the production of large numbers of meals, ready-made food, through a variety of community and institutional kitchens. And one example is the large-scale Maple Leaf Sports and Entertainment facility, which usually caters for large sporting events, has pivoted to community meal preparation. But the question is, how can these relationships continue to be cultivated and embedded in long-term response and recovery? In Canada, like many countries, primarily in the global north, we have an export market and a food system that's controlled by a small number of large corporations. And this leads to fragility and concentration of power. So the question becomes, how can we manage the tension between health and economic recovery while promoting food security and a healthy food system? E-commerce has emerged as a solution for all food service providers, big and small. And what will this mean in the longer term for food security and sustainable food systems? It can go either way. The question comes about what coordination structure makes sense. What is the appropriate role of cities, community food organizations, private sector, and national and provincial governments? Ones that can build on both the old and the new relationships across these sectors. A few years ago, the City of Toronto undertook a food vulnerability assessment to understand and identify the most significant climate risks to food access and distribution, and to determine actions to mitigate those risks. The focus was on the key climate risks for Toronto. These are flooding, heat waves, and ice storms. And under each scenario, we identified vulnerabilities for food wholesale, retail, food services, and restaurants, as well as the neighborhoods most likely to be impacted. It's no surprise that in every instance, the study determined higher risk and more severe impact for low-income neighborhoods. And while the key focus was on shocks pertaining to these climate risks, the ongoing stresses pertaining to food security were also identified. A key learning from this study was the importance and the need to better understand last mile distribution logistics in order to support access for all communities and to promote stronger community food resilience, especially in vulnerable neighborhoods. This, in fact, requires a more granular food flow analysis and asset mapping. In Toronto, it requires a better understanding of the capacity of both the food, retail, and not-for-profit sectors. And for the global south, and even in some global north contexts, it certainly requires a better understanding of the role and logistics of the informal food sector, which is a primary source of food for many communities. But of course, none of this anticipated the scope and scale of the current pandemic. So to close, I'm going to share a concept that may be useful to navigate this crisis. As I said, on a personal level, I recently retired as the manager of the food strategy. And retirement has thrust me into a liminal state. The word liminal means being on the threshold. It's a point or place of entering or beginning, when you're no longer in your current state, but you haven't fully yet transitioned to the next one. It's not a passive state. Yes, there's huge unknowns ahead, but also multiple opportunities to be proactive and create new priorities. The COVID-19 pandemic, it seems to me, has thrust the entire world into a liminal state. No one knows what a post-COVID world will look like, and absolutely nothing can be taken for granted. At the household, community, institutional, state, and global levels, we're in a state of overwhelming ambiguity, disorientation, and anxiety. I believe we collectively are standing at the threshold, waiting for what's next and what our new normal will look like. There's enormous pain and uncertainty, but I strongly believe it's up to all of us to recalibrate our priorities and to reorient our institutions, food systems, state priorities to ones that support a more equitable society and respect for our planet. Thank you.
And thank you, Barbara. That was wonderful. And again, a reminder, please send us questions. We'll get to as many of them as we have time for. Barbara, from Toronto's experience planning to address the food impact of climate change and to promote resilience and sustainability, what did Toronto learn about how to find the right balance between protecting health and the environment on the one hand, and protecting the economy and economic growth on the other? And who were the allies you found in city government for the view that economic growth was not the only or the priority goal?
Yeah, this is a huge question. I think we at a very emergent state with this. I think the first thing I need to do is to unpack that a little bit, because we aren't at the place of being able to say health and environment are one. We're very, very siloed, and part of the efforts through the food vulnerability assessment were to share and collaborate with both health and environment staff to begin with, to get a better understanding of the role of food in an environment and climate change planning, and the role of health within that. The food vulnerability assessment itself brought together key stakeholders from multiple city divisions. And I really believe this is about relationship building. And so we were able to work with colleagues from Toronto Water, from transportation, from solid waste, from social development, from social services, from health, and a range of health programs, to come together and to plan something where each separate silo or program or department could actually see themselves in the solution. The other huge opportunity that we had to frame this was the Eat Lancet Commission report that was released in January last year. We had a series of events that we brought multiple cities together, to multiple programs across the city together, to understand that food that's good for people and the planet is a really important part. From the economic development perspective, the food services sector is one of the largest sources of employment in the city. And of course, employment is a determinant of health. So at this point, as both other speakers talked about, the scale of need and support from an economic development perspective has grown so huge that it's about figuring out how to collaborate with all levels of government and the not-for-profit sector to be able to build on the existing government supports that are short-term, and how to embed community economic development with food as a huge employment source and economic driver in the city. Not sure if that answers your question.
It does, thank you, or it starts to. It's a big question.
Yeah.
Thank you to all of you who have sent questions. I'm going to now pose questions to the panelists, and Kim Kessler apologized for having to leave to go to another meeting, and thanked you all for listening to her presentation. And Barbara and Holly, I'm going to ask you to give short answers so that we can get to many of the wonderful questions that are coming in. And here's the first one for the two of you. Can you explain briefly how your cities funded both their municipal responses to COVID and the earlier efforts? Was this public money? Was it city money? And yeah, so I'll turn to you. Holly, you want to start?
Sure, thank you. That's a really good question. So the city funds the staff, my team. So that is ongoing city funding, and that has resulted in our ability to move relatively quickly with the COVID-19 response and continue to do so. As far as other funding allocated, what we found is that we were able to mobilize the federal funds immediately, and that was why our strategy started off with a meals approach only. And then we were able to use the federal funding of the CARES Act for approximately, I think it's around $8 million that we've had allocated through CARES. And that is our primary funding at this time. And then we're going to be planning on doing FEMA federal reimbursement as well. So all the funds that we are spending through the city, we're hoping to be able to get some version of reimbursement if we're not able to use it through CARES.
I would say Toronto is fairly similar. We've been leveraging federal funding, which is not sustainable over the long term, but has allowed for a massive scaling up of emergency food provision in collaboration with our food bank and food rescue partners. There's been a huge outpouring of private sector and public donations. I think people at a visceral level really understand the importance of food security at a time like this. So there has been that kind of private sector funding. The worry, however, is what's going to happen over the longer term, because in the recovery stage, the needs are still going to be there. Like Holly, the staff for the food response are city staff, and they have been moved over to our emergency operations center and are working right across with colleagues in the emergency operations center, and are starting to engage in the economic recovery domain, bringing the food perspective there. But I don't know if it's the same in the United States, but in Canada, cities legally are not allowed to go into debt. And so there's real concern about the elevation and escalation of city resources that have gone into this. So we'll probably be facing big layoffs.
Great, thanks. And there's a huge concern in New York and other cities about the austerity measures in response to the economic downturn that will worsen the impact of COVID rather than address it. I have two questions that I think are a little related, and I'll address them to both of you. A question from Liz McMillan. Looking at cities' responses to food supply during COVID-19, do we see a possible systemic change in our industrial food system? Is there a way to link managing up from cities influencing overall national food chain, and particularly as it relates to perhaps meat and dairy? And there's a somewhat related question from Dennis Olson, which is, has Baltimore, or Toronto for that matter, signed on to the Good Food Procurement Project, a national effort to use procurement policy as a way of improving food supply? And where do you see projects like that, using procurement, fitting into our response to COVID? And Holly, maybe we'll start with you and then turn to Barbara.
Sure. So, good food procurement. We have been working on it for years. As far as we embedded good food procurement practices and policies into our summer feeding program, into our older adult program, and we have been taking the guidelines and been implementing them into all contracts we're doing related to food procurement. The challenge we have found is not the issue of good food procurement, but the issue of procurement and the city's procurement process and the way in which we do procurement, which has made it much more difficult to do the food component. So that has been an ongoing challenge, but we do have the buy-in of the city on good food procurement. With that being said, the procurement contracts for the summer feeding sites did mobilize and use the standards we already had set forth with good food procurement in mind. And that was really focused on meals. Our good food procurement right now is focused on meals. And I think that needs to be changed as we look at grocery boxes. As far as the procurement, we decided to go with the Maryland Food Bank because they were able to procure the food at the lowest cost, and they were able to get access to the food early on when everyone else was having supply chain issues. But one of the decisions they made because of COVID-19 was that they reduced the standards, the nutrition standards of those grocery boxes. And so when we contract it out to the food bank, I would say that that does not embrace good food procurement standards.
Thank you. Barbara, anything about either using this crisis to shift away from the industrial big food system to a more local one, and anything on food procurement that you would want to add?
Yes, I should have mentioned before that the City of Toronto is a signatory to the C40 Food Declaration, which aims to pivot food procurement to food that's good for people and the planet, which in itself has to promote local and regional food procurement. So we have even high-level political support. How that will be prioritized going forward remains to be seen, but we have that endorsement in place. The visceral response that people have had around absences on the grocery store, I was amused to see personally. I don't know if it's the same in the US, but there's a huge shortage of flour in our supermarkets here. And at the same time, there are all these articles about that our grain supply stockpiles have never been better. And so it's about being able to pivot from the large corporations to a more retail market. So it strikes me and a lot of food leaders and advocates here that we have to build up the middle infrastructure. And of course, the meat supply, where we've had massive outbreaks in meat processing, is going to create some shortages of meat in the near future. So we have to use this opportunity to promote the middle. Toronto, while we've got a strong foundation in food, has bumped into the pressures and the trying to balance health and economic development and local procurement. And bizarrely enough, despite the fact that the provincial government has declared farmers markets essential services, the city is still not allowing farmers markets to operate right now. So that's an ongoing fight, and I hopefully will win that. But continuing to support community-supported agriculture and initiatives like that is a priority now, and hopefully will remain as a systemic change.
Great, thank you. Another question for the both of you. Is it possible for restaurants to, this is a question from Vivian Wang, is it possible for restaurants to pivot their work to support food assistance and also to support small businesses and restaurant workers? And what's the experience in your cities and your thinking about restaurants taking on food assistance responsibilities?
For Baltimore, I would say this is a great challenge. When we talk about food assistance and we're talking about meals, we're talking about $3 to $5 per meal. And the restaurants that would like to be able to do a food assistance are talking about usually $8 to $10. So I think that there's a challenge of looking at the matching of the economic needs of restaurants and the price point they need and food insecurity. And I think it's not as black and white of whether restaurants should be working in the food insecurity space of the lowest price point, but really looking at where is that middle market and how do we make sure that those restaurants can be helping in that mid price point, or maybe we can find a way to help those restaurants be able to work with populations and have those populations buy from them where they're not having to be at $3 to $5 price points. But I would say that's been a challenge. World Central Kitchen has been stepping in, trying to do that as well nationally. I think it's also been a challenge in Baltimore of trying to support the restaurants. And that's one of the components we're hoping to move forward with World Central Kitchen, is the linkage of supporting those restaurants and paying the restaurants to prepare and deliver foods.
And a perhaps related question is, as restaurants are laying people off or firing them and supermarkets are hiring people? Is there some way to make that transition that enables families and communities to support themselves? Barbara, do you have thoughts about restaurants and food assistance?
That's a great question. And funnily enough, we've got a wonderful emergent initiative, whether or not it will get legs and become institutionalized. There has been an outpouring of private sector and other donations to feed our healthcare workers, which is essential, but it's not where the highest need from a food security perspective has gone. So we've started this small little, we hope, prototype initiative, so it's scalable. In one of our low-income neighborhoods, there was a fairly large amount of money that was raised through crowdsourcing to support restaurants. And so we are working in this neighborhood to get some of the local restaurants to begin to provide some meals in that community and thereby support that local economic development. And that kind of thinking is beginning to happen through a collaborative, again, at an early stage, where what we're trying to do is to push the city and other institutions to use to leverage their procurement power to promote local economic development and supporting local businesses, and in particular local restaurants, and the employment that comes through that, as well as the promotion of community resilience and food security, is a high priority. But again, that's in an emergent state, but we're documenting that. So very interested to see if that can become a new way of thinking about anchor institutions.
And just to broaden the vision of what's possible by looking at some other countries, in Brazil, in the former government, some cities subsidized restaurants, would give them public money in order to offer low-cost meals to low-income communities, both creating jobs in those communities, but also encouraging them, requiring them to buy food from local farmers, local and regional farmers, and therefore supporting maintaining farmland. So it was in a view where we see the public sector and food as having an expanded role. We could look at public money as creating restaurants that could operate at a price point through subsidies. Imagine using subsidies for that purpose instead of subsidizing the giant food corporations and the corn and soy and sugar farmers to improve health and affordability. The next question comes from Caitlin Dorward from the city of Vancouver in Canada. And she says that perhaps there's a need for food policy not to be located in a single food agency, but to be embedded across city departments to better enable a systems approach. And I wonder what the experiences have been in Baltimore and Toronto in thinking about that wider approach and what's worked and what are some of the problems in that.
So Baltimore has done that. That is our strategy. We have staff in many agencies. And if you go back to that wheel, we're not all housed in one location, and that's been very intentional. And I think that has been one of our greatest strengths, is that we have a lot of agency buy-in before we even started the COVID-19 food response. Anyway, that's my main point to that.
I would say we've also done that in Toronto, and we have a really long history with food policy, with our Toronto Food Policy Council celebrating 30 years, and having a food strategy that currently is located in public health, but is a citywide food strategy. So the initiatives engage colleagues from multiple city divisions and departments. And it's an ongoing debate and struggle of where the best location is that enables stable resourcing, but very effective cross-silo collaboration. So it's a very important piece, and there are many city departments that it could fit into, as long as the intent is to work right across.
And the last question comes to you from Nick Freudenberg in New York City. And this is both a question that will maybe enable us in New York to learn from what you've done in Toronto and Baltimore. In New York, until recently, food planning at the city level and the state and regional level were very separate. And yet we share a food shed, we share a food distribution system, and we also share a political system, a state government and a national government that, that work across the city, state, and regional levels. And I wonder, and I think just in the last, in part in response to COVID, we've seen some green shoots of efforts by city and state officials to begin to work together. I wonder if you could tell us what you've done in Baltimore and Toronto to cut across city lines and regional lines, and what you could, what advice you could give to New York City as we look to develop a more regional approach to food planning and emergency response.
So for Baltimore, I would say that we've had ongoing relationships with the state on food, whether it's food systems, food resiliency, emergency food. And so that was just expanded upon during COVID-19. But I think that where the new territory we've moved into is with the leadership of I think Jonas Smith over in DC, that she's been pulling together all the regional leaders of Maryland, Virginia, and DC to have weekly calls to kind of talk about how do we look at more of a regional food system approach in response to COVID-19. And I think that has been really valuable. I think that one of the things that I've learned is that I'm working very closely now with Baltimore County and our urban ag and agriculture response and local regional food response. We're seeing a more collaborative nature of how to be looking at food supply. And I think that that's been sort of our stepping stone for us of looking at working with multiple counties as well as sort of the regional approach.
I think there's huge momentum on this right now, which is very exciting. We have a newly established municipal / food policy network at a national level that has membership from across Canada on a range of food policy issues and the linkages with municipal government and promotion of city region food systems. We have wonderful leadership and I guess networking through Food Secure Canada that again has engagement and membership right across the country. In Ontario, Sustain has been working right across the province. In the City of Toronto, we have the Food Policy Council and the Food Strategy team. So I think that this is really building. It's going to influence the look and outcome of a national food policy. But we just have to keep that advocacy and pressure up and make sure that the equity lens remains as the focus.
Thank you very much, and thank you to our speakers and to all of you for participating, for sending us your questions. To remind you, we'll be posting a video of this session on our website within the next day or so. We'll also include resources and the slides that you saw. And we hope this will be a resource for the others. I also wanted to tell you just a word about our next forum, which will be on June 24th. We'll send you messages about it. And our topic will be ultra-processed food, a slightly different topic. We'll be looking at the new research evidence on the role of ultra-processed food, foods that high in fat, sugar, salt, and multiple other ingredients that few people would call food, and what role they play in the epidemics of both diet-related diseases, obesity, diabetes, hypertension, cardiovascular disease, but increasing evidence that they also play a role in vulnerability to COVID-19. So that's up next, a topic that hasn't been explored so much in our forums. Thank you, stay well, be safe, and we look forward to seeing you again.
Thank you.